All right. Good afternoon, everyone. My name is Tanya Cole with Sedgwick County, and I want to thank you for being here this afternoon for the Black Alliance meeting with Sedgwick County Commission. We have about upwards of 30 participants that will be on this call, and so I would like to recognize the elected officials who will be on this call. Senator Aletha Faust-Godot, Representative Gail Finney, Representative O. Hobson, Councilmember Brandon Johnson, Commissioner Lacey Cruz, and Commissioner Jim Howell. I do want to talk about the ground rules. This will be a 1-hour meeting from 1 to 2 today, and so we want to stick to that time schedule just because there will be other meetings and other schedules for other members that they need to participate in, so we want to stick to that 1 hour. I would ask that you mute your devices. If you would like to speak, there's a couple of ways we can handle that. Just please raise your hand if you would like to speak, and we will make sure that you get in the queue. You can also send a message to Aaron Norton, and he will put you in the queue as well. We have a number of topics to cover, and so let me go through that real quick. We'll talk about testing opportunities, costs related to testing, personal protective equipment, PPE, availability and recommended uses, transportation opportunities related to testing, sampling data, sharing and collection plans, small business reopening plans, community support, communication, contact tracing and health workers, federal stimulus review process, and we also have Dr. Luella Sanders to talk about homelessness and COVID. And so I'm going to send it back to Commissioner Cruz, who's going to kick off the meeting as well as moderate the meeting.
Hi friends, I was having a little trouble with my computer, so here I am over here. So I'm just going to start off. I'm really here to listen. I think I won't speak for Commissioner Howell, but that's really the purpose of today's call, is to hear from you all and how we can best serve the community better. So first, let's talk about testing. I'm just going to, here's how I'd like to run it. I'll talk about a topic. If you want to join in, please, like she said, raise your hand. Testing right now, I think yesterday morning we got a briefing from Tim Kaufman. He talked about having 9,773 sampling kits, and we have over 10,000 on order. That's currently, we are in the process within the next 2 weeks, hopefully sooner, to have a randomized sampling. So that's kind of our testing update. As far as, I hope everybody understands that testing through the health department is free. So if you have symptoms or signs, call 211 and they will send you to the appropriate place. So at this time, I'd like to open it up for any testing questions, concerns, comments. Let me know, Aaron, if you're getting any. Okay. So I don't see any questions regarding that. So the next thing is Councilman Johnson sent us out a list about kind of all of the things that you wanted to talk about. So let's talk about response, adaptive and recovery services. So we talked about mental health. We're talking about hopefully figuring out ways to, I spoke with Joan Tammany yesterday, and she gave me a really good rundown of kind of the calls that are happening in the community. How can I see? Hold on just a second. Let me fix my view here so I can see. Hold on just a second. Bear with me. I'm not at my workstation. Okay, here. There we go. Okay, there you all are. Hi. Can everybody just wave for a sec? Yes. Okay, thank you. Awesome. Okay, so let's get back to response and adaptive recovery services. So I don't know, who would like to kick that off? I don't want to be talking. I want to be listening this meeting. So if anybody else wants to jump in, please feel free to do so.
Commissioner Cruz, and certainly to Chairman Meitzner, thank you guys for hosting us this afternoon. As it relates to testing, response, and adaptive recovery services, Currently, given the near $100 million that the county has received or is in the process of receiving federal government funds, what does the process for securing these particular funds to address these particular concerns surrounding testing and adaptive recovery services, what does that look like currently, and how can we be assured that the Black and brown community will receive the lion's share of those resources to be able to address the issues that most impact this most vulnerable demographic?
So I think let's talk about the stimulus review team for a second. So that money that you mentioned will be overseen by a group of members that were sort of selected that understood government finances. We also have a group called Widow Bryan, who is a national company that was recommended to us by our finance CBD auditors to understand how to best spend the money so that obviously vulnerable populations get the testing they need, and the community as a whole. How can we make sure that this virus doesn't spread, and how can we make sure that it's equitable amongst communities? So I'm glad that we're having this conversation. The testing itself. So right now, what's happening at Health Corps, Brandon, would you want to speak to that? I mean, we're doing random sampling right now. As it's set up, we have just this week, Health Corps started the sort of random sampling as far as those who drive up and want to test, get a test. At 211, if you call, obviously it's set to symptoms and signs. We're waiting until we can understand the best way to random sample our community. I can't hear you. I think he's muted.
Yeah, Dr. Holder's muted.
Can you hear me?
Yes.
Yep.
Okay. Yes, we understand that when it comes to demographic testing, it is our collective understanding that most of those who are coming to Health Corps in those particular locations where random testing is taking place, it's really not really impacted the communities of color to the numbers that we believe is necessary to be able to have a good sample size coming out of that with, the predominant group is not African American or brown people who are receiving testing. Those tests that are happening at Health Corps and other places are those coming from all across the city, because those health institutions are up and running for that purpose. Are we seeing more testing geared towards the Black and Browns community specifically?
I think we're testing those who call in with signs and symptoms right now. I think
it's crazy.
Yeah.
Yeah, and I think that is the concern, because we understand that most of those who are part of the Black and brown community, they're already disadvantaged, whether it's transportation, whether it's having clear communication that comes out from the county, from our health board here in Sedgwick County, to make sure that they know where to go, what to expect, that they understand that the testing is free. If they have transportation issues, that we can get them there so that they can receive adequate testing. Because if this demographic is left out of the testing process, it's going to be counterproductive because they're the ones who are likely to be carriers, whether it's asymptomatic or whether they have it and they're showing full blown signs of it. We need to ensure that there's adequate demographic testing of the Black and brown community, and that they have access to these resources. And we've got to get that communication out to the Black and brown community so that they can receive testing that's commensurate with other people populations here in Sedgwick County.
Yeah, I hear you. We need to do a better job of communicating for sure, and making sure that everybody gets that communication. I see that you guys put some different media outlets that we do need to utilize in order to reach this population. Are there other media outlets that you would that were left off of this list that we could include?
I would defer to Councilman Johnson to answer that.
Yeah, thank you, Dr. Holder. Before we go to that, just going back to the testing piece, the point that the Alliance is trying to make is that the model from Health Corps has been beneficial because there are no barriers there. So although they've done about 589 tests thus far, a little less than half of those are Black people. But the key point there is that you can just drive up and get it. You don't have to have a fever. You don't have to have a cough. And when we talk to people in line, when I went up there, they all said this was the benefit to them because they didn't have those symptoms. They didn't have those barriers. That was why they showed up. So what we're trying to do is make sure there are enough tests within the Black community, which is more susceptible, at our community partners, and that they're accessible. I know that Hunter Health is working towards more walk-up testing. I know GraceMed is doing the same thing, but we want to make sure there are enough tests in these places that we get tests. And with respect to the community sample size, that's fine. But again, we just need to make sure that the Black community is getting tested. We saw the study from Berkeley that showed a third of the deaths in COVID-19 is Black people. So we're trying to make sure that Black people have access to these tests in these spaces because we have wonderful partners. We just want to make sure the access is there for the community.
Yeah, certainly. And I think that that's the goal, and that's what, I think that's exactly what we want to do. That's why we're ordering more sampling kits and want to make those available to the Black community as well as all the community. So if we, I've been trying to emphasize the 9th Street location if it's a matter of access points, or a mobile testing unit, or we've been talking about those things as well. So does anybody have anything else regarding testing that you'd like to discuss before we move on to contact tracing?
If we are dealing with mobile testing, how long is it going to take to stand up adequate mobile units to be able to get to the various areas throughout the community where this particular vulnerable demographic resides? I think, weeks, we're too late.
Yeah, I think, we are working around the clock around here and trying to do the best we can with this moving target. So that's something we want to make sure that the stimulus money is spent. And there's lots of levels of scrutiny as far as this money goes. And so the voting members of this federal stimulus review team will help us address exactly what needs to be purchased, hopefully as quickly as possible, and mobile testing and access and more entry points to testing around the community is exactly what we're trying to make happen. We're working as fast as we can. I wish that we could work faster. I think that there's a lot of folks who are just, we're doing the best we can.
So Commissioner, on your point with this committee, there were 3 names that the Alliance was looking to add to that we sent in that document, looking at Michelle Van, Bryce Graham, and Wanda DeShazier. Again, that was just to ensure that this community also had a little more representation and backup. Melody, having the experience of state legislature and county as well is great, but just making sure that we had other voices at the table as well. Is that something that we could get added to that committee, even if they were non-voting members?
That's something that we can certainly run by the commission, because we voted on this group, and so that's something that we'd have to run by them. But yeah, absolutely.
Yeah. Thank you.
Yeah, I'd like to also throw out there, if it's okay. I asked a couple questions yesterday on transportation. Right now, if somebody identifies transportation as a challenge for them to get to a testing site, we have transportation solutions available to us right now, and they've been using this for a while. Apparently, they said for several weeks they've been doing this, and so as far as we know, if that becomes a barrier in any way for someone to get tested, we have a solution in place. We're going to continue to find other transportation solutions as well. We're not satisfied we're there yet, but we do know we have something available now, and there's more coming. And then secondly, Yeah, I talked to, I did email Senator Letha Fausto on this, and she can attest to this. We did talk about some money for advertising and trying to get the word out. And we need everybody to understand that testing is free. That's number one point is testing is free. And we also talked yesterday yesterday in our meeting, we have some capacity left at our West Central location. We have some capacity left over there. And so there's actually more people at the Health Corps site that Councilman Johnson helped set up. There's more people there that wanting to be tested than they have capacity for. If we can get the word out, we're trying to get it approved. I don't think it's approved yet. We'd like to do people with asymptomatic, I should say no symptoms, be able to test the extra capacity or use that extra capacity at the West Central location to hit the same folks that would want to be tested. So that's not turned on just yet, but I think it's going to be turned on soon. Again, I think as Commissioner Cruz said, we have enough test kits. We ought to be testing as many people as want to be tested in this community. So
yeah,
get the word out.
And thank you for that, Commissioner Howell. I think the other thing is when we're sending folks to call 211 is let us know where they're at and if they do need transportation. And I think maybe I don't want to simplify it, but let's ask the question: do you need? Are we asking at 211? Do you need a ride? Do you need an access point? Like, is that your problem for getting testing? I think there are certain questions and just maybe simple questions that we can ask that might prompt more answers. Because right now, we don't have that information as far as who needs transportation. So it all comes down to communication and doing a better job at that. And I'm open for other suggestions on ways to improve for sure, because there's a lot of places to communicate and there's a lot to communicate. And the last thing we want is for someone who needs a test to not have access to it.
And with that in mind, I want people to know that we earmarked $25,000 out of this CARES Act funds for specifically radio and TV and print media to get the word out, where the test sites are, how to get access to testing, the fact that testing is free. All that information should be flowing out to the community with that $25,000 earmarked for media and communication purposes.
Yeah, and one thing that was approved yesterday was 47 different positions for the health department. So those were, kind of moving on to contact tracing and helping people understand. I think when we have more people doing the work, we're going to be able to communicate it that way as well. I think Lavonta had a question.
Did, and it did pertain to transportation. That was a huge one for me as well. So I thought yesterday when I watched the meeting that you talked about transportation available. I didn't know if that was one van, one car, how that worked. And so how will the community then, in calling 211, is that the main source of getting the transportation?
Yeah, right now the health department actually has a tuberculosis vehicle, so we already have a secured vehicle that we could pick folks up. So it's really just a matter of calling the number and scheduling an appointment.
Okay, so that definitely is then one of those communication pieces, because people need to know that especially.
Yep. Yeah.
And on top of that, we're in the process of, I think, purchasing probably 2 more vehicles. Possibly a van and a car that will be outfitted for protecting the driver and the folks that want to be tested, make sure that everyone is separate and safe. And so I think that's the effort to purchase a couple of vehicles is already moving forward.
So
Do we have the capacity to be able to formulate some kind of standard communication protocol that comes from the county? So that we can, as pastors, as other organizations, put it on our websites, flood the airways with those communications so that people know specifically what is available to them, what to expect, what their responsibility is. We have called in and asked for testing, but, was not, asked, do you have adequate transportation? I think there needs to be some standard protocol that possibly could be put together to communicate exactly what services are offered, where those services are offered, and how they can access those services with ease so that they're user-friendly.
Yeah, I think once we'd be happy to share the communication with whoever wants to take the lead on that and make sure that we're communicating it appropriately to the right channels. So I'm happy to work with you and send out. We just are kind of ramping up our communication strategy. So we'd be happy to share drafts and figure out what's the best tool and messaging for the community. I don't know if that's you or Danielle or Councilman Johnson or, Aletha, whoever that is, maybe a point person to help us, if that'd be agreeable.
I'm sure that Councilman Johnson and I and others can work with you to get that going.
Okay,
Hey, I know LaWanda wanted to jump in and talk about communication a little bit.
sure.
Yeah. All right. So thinking about getting the message out to as many people as possible, just based on numbers, 25K is kind of a low budget. And so we would like to see an increase in that budget so that we can make sure that we hit all the media outlets, culture, TV, community voice. 25,000 is going to go super fast. And when we're talking about making sure everybody is tested, there's a population that we know the message is not reaching. And so we are asking that the 25,000 be increased.
Certainly, I think that we can accommodate that request.
Right. And I know Brandon sent you a list of some outlets. And so, yeah, so we do have some specific outlets that we would definitely like to use.
Yeah, absolutely. Those are, yeah, definitely on the list for sure.
So how do we know, what point in time will we know that those media outlets will be contacted, or what will the process look like to make sure that those media outlets are included in the communication process?
Well, we just approved that funding yesterday. I'm sure that they're working today. I know that we have contracted with Bothner and Bradley. I know that Tammy's probably working on something already. I know Tony back here, he's shaking his head. I'm sure he's on it. So we'd be happy to share that. I mean, if we need to, when you get lots of people voices around design and stuff, it could get muddled for hours. I mean, anybody who's ever designed a piece understands that. So we probably need to try to get it done quickly, have a point person to run this stuff by. So whoever you guys appoint, we'd be happy to share that with you.
Awesome. Thank you, Commissioner. And just to give an idea on the budget, what LaWanda was talking about, for Juneteenth, Power 93.5, if you want to run just one 30-second piece for, I believe, 7 weeks, you're looking at $1,500 right there. And that's just one piece an hour. So if we want to really increase that and get the word out, we're going to have to beef that up quite a bit because that's just one station. I don't know the rates for KSUN or Culture. Community Voice may cost a little more, but they reach a lot of people that we can encourage that. And then social media spending as well. And one key thing is for anybody who doesn't have access to any of that in our community, and a lot of folks in low-income areas don't, those individual mailings are key too. And I don't know what that looks like postal rate wise, but that was kind of why we wanted to see a beefed up number to make sure we really reach everybody that needs to be reached.
Yeah, I think that was just a starting point. I worked in communications for a long time, so I kind of even was a little bit, that's a low number. So yeah, we got to start somewhere, guys. That's where we started. So yes, absolutely. All right, you guys want to move on to, so I kind of talked about the community health workers, the 47 positions. So we're looking for people, if you guys know some folks who fit, we're going to have that up pretty soon as far as how to apply and those kinds of things. So like I said, that just got approved yesterday too, so we're still working that out. But we are looking for some more, I think like 12 contact tracers. There's 7 disease investigators, 1 epidemiologist, 1 fiscal associate, 5 data analysts, 8 back office folks, a lot of positions. So if you know, spread the word, if you know anybody that fits those characteristics. And that's kind of how, we're looking at community health workers and contact tracing. And I see some of these positions located or locations listed here. So do you guys have any questions regarding that?
Who do we contact to receive that information so that we can identify people within the community who may qualify for those positions?
So it's probably going to go through our HR partners. Sheena Schmutz is who she's. I think they're still working on that. So I can send out an email as far as when all those positions are going to be up and live to apply for those. But it'll definitely go through HR.
What are the salaries for those positions?
I think they kind of vary on position type. I don't have exact numbers, but the total budget that was requested was $1.8 million.
Okay.
Excuse me real quick while I take a drink.
Other questions surrounding that and the possibility of non-for-profit organizations being able to hire and train residents to do what work could be done those non-for-profits?
You're asking to hire people to work at non-for-profits? Is that?
I was asking the question to Brandon.
Oh, sorry.
It was a discussion we had.
Yeah, Pastor, last night there was a discussion about maybe some of those funds being used for contact tracing, flowing through some of the organizations that have deep roots in our community, like the Urban League or Power CDC or some of our churches. If there was opportunities to do that, then these organizations probably could get folks that could also do that work as well.
Mm-hmm. I think
Right.
There's so much collaborating going on in the community, like all of the health clinics plus our health department. There's so much collaboration going on that I could see somebody being hired by Sedgwick County, but working with, an organization. I mean, we all kind of work with the bulk. I mean, it's a real community effort for sure. Any other questions around contact tracing? Do you see anybody?
Yeah, the reason for my inquiry about the salary was to ensure that people that are taking these positions are being paid well. I think it's going to be crucial that people are paid at the minimum a living wage, and that they are provided with health care. So I would be interested to see if benefits are going to be available for those folks, because this is a high risk job. And those folks are putting themselves at risk and their families. So I think that should be taken into consideration in terms of the salary and benefits for those positions, as well as if they are salaried, non-exempt, or independent contractors.
There was a lot of discussion around that actually yesterday. So I think that's still fresh. In the conversation. I mean, I asked those questions yesterday, so that's some follow-up that I need to do. You bring up good points, and they are salaried positions. They're 40-hour-a-week positions, and they are going to have benefits. The question between contract and Sedgwick County, there was some discussion around that. That I think is still being worked out, but if I had to say, they'll probably be Sedgwick County employees.
And Commissioner, if I could ask a question, I put my little raise my hand thing, but that doesn't work sometimes. Do we know how long you have to disperse or to use these funds? Is there a time limit or a timeline?
Yes, December 30th.
Wow. Okay, so if we're looking at hiring December.
I'm sorry, unless things are very fluid though. So I don't want to say that that's a hard and fast deadline, because it seems like everything is changing by the minute, and so I don't want to assume that it will get pushed back. But I think that is a possibility. But right now we're working as December 30th is the day that we have to exhaust the money or give it back.
Wow. Okay. And so just along with the people that you're looking at hiring, could we also look at possibilities of that testing process to go on Saturdays, where there could be work with the city to provide transportation to those testing sites? So that would be to hire additional people to work on Saturdays.
I think that's something we could definitely consider, yes.
Okay, and so you're looking at the hiring process then. So DeJuan, it sounds like those funds and those positions then would last until the end of December, the end of the year.
Mm-hmm.
Okay,
Yep.
thank you.
Any other questions regarding this, or do you guys want to move on to personal protective equipment? F397, whoever that person is, has a question. Can you put in your name?
Yeah, sorry, it's Danielle Johnson.
Oh.
So my stuff is connected at Wichita State, so it just did that. Question on some of the funding, though. There was some conversation around whether or not these are reimbursable funds. So do organizations or folks that can't apply for these monies, do they have to put that money up front and then it's reimbursed, or how is that working?
Yes, there's all of these funds are going to be highly scrutinized. So for us, we had to sign something saying that we're going to be audited really heavily for these funds. So if we give these funds down the line, let's say, then we're going to be responsible for all funds that are distributed. So does that answer your question?
So will organizations, they will have to put that money up first and then
Yes.
have those expenses reimbursed? Okay, is there an opportunity, so for a lot of our organizations that wouldn't have that capacity to be able to put money up front, what's going to be done for those organizations or businesses or what have you?
Well, like protective personal equipment, there's been some talk around, if there are folks who need personal protective equipment, they can order it through us. And then we could disperse some of that. That's, as far as other things, just talking PPE right now, if a location needs gloves and masks, they can purchase it through us. That way they wouldn't have to pay for it up front. We would actually pay for it up front.
So what kind of supply do you have? I know a lot of the concern, especially from those in the barber and beautician industry, we're looking at, they're already hit really hard on finances. So the cost of acquiring more of that, will it be a cost to acquire it from the county? Will it be given to them? Is there a way that the county could maybe buy bulk and then get that out to businesses and our faith institutions that have folks coming back since we're opening up?
I think that's something we could definitely talk about for sure. I think if people need the equipment in our community, we want to make sure that we're very diligent about how it's used. I think it's important for us to understand the need, and that, because I think sometimes when you open things up, people might ask for things that they're not actually going to use, and it's a scarce commodity. And I think we need to be very diligent about, how we give it out and give it out to those people who actually need it for sure, and the amount that they need. So I think we have to be careful because there is a limited supply, and the last thing we want is for those on the front lines to not have what they need. But to make sure people have what they need, it's a delicate balance. Levanta, did you have something else? Senator Faust, I see you. I'll get you. And then Kevin? Okay, Levanta, did you have something? Okay, so Senator Faust-Scudo. You're muted.
Now,
There
can
you go.
you hear me?
Yes, ma'am.
So can you hear me now? Okay, very good. Thank you, Commissioner Lacey Cruz, for taking our call of action. I wanted to know, is Commissioner Jim Howell, is he still on?
I am still here.
Okay, again, thank you for responding and reaching out. The email that you sent, I did share it with others with the Black COVID group. I wanted to know, I didn't watch your meeting yesterday. Did you have those items on your agenda to move forward with?
The items were not specifically on the agenda, but we did talk about the items. They came up in natural discussion. We had, I think we had 5 or 6 different topics that came up during the agenda that relate to COVID-19, and those topics did come up. Things like transportation and communication. Those issues were discussed at length yesterday during the meeting.
Okay, so are you going to submit and put that back on your agenda and amend it with what we're requesting today?
Yeah, certainly. I'm writing down the request from today. We'll add those things into the discussion. Our next time to talk about this is next Tuesday morning in our staff meeting. We'll be talking about COVID-19 at that time. We can't vote and take binding action at that meeting, but we can certainly discuss it and get consensus and direct staff as well. So we'll be doing that on Tuesday.
Sure. Thank you. Thank you so much.
You bet.
One thing, Kevin, real quick, just before you speak, we are going to we're developing a solicitation of needs in the community. So we're going to be sending. I'm not sure how that's going to. If maybe it's on our website or some sort of communication to the community as far as notice of your needs. Kevin?
And when we were talking about PPE, we need to strike the balance and make sure that PPE is only going to the people who really need it. And I'm just wondering the degree to which we have anticipated the possible second wave of this that's been discussed, and the fact that whatever our PPE needs are right now, those PPE needs may return, or they may even grow. We don't know, but we need to have a plan in place to make sure that we've got supplies for a coming wave if we see another one. And I want to make sure that, because I think that the great tragedy would be if we are, try to be so judicious in the spending of $99 million and we turn in $97 million, and then we end up with the second wave and we are short on supplies.
Hey, Kevin, I don't know if it's just me, but you're really cutting out. So I think you're talking about making sure that we don't be so frugal that people don't get what they need. Is that kind of the gist? Oh gosh, I can't.
That's kind of just about PPE that we are anticipating essential PPE.
Is it just me?
Moving forward, so that we don't see all the funds turn back in, and then we find ourselves unable to supply our needs a second wave.
Yeah, I'm sorry, Kevin. You were really cutting out. So I hope it was.
I'll shoot it over.
Okay, thank you. I think that we have to do a really good job of communicating to folks to get their needs to us. We just really have to do, I don't know if it's knocking door to door, I don't know what it is, but we really have to make sure that we understand that, we want the community to get what they need. We don't want this to spread. We don't want for people to go ill and not have the access to things that they need. So making sure that we communicate it, and that's why we're working on developing this tool that people can tell us what they need so that we can help them get it. We have Olitha and Lawanda, and I don't know if it's Lawanda?
Okay, one of the things that we absolutely found out when the schools closed, Commissioner, is that so many people do not have internet service. And so maybe you could put on your list to hire some canvassers, the Hispanic community, the African American community. So many people do not have internet. And if that's the only mechanism that the county is, or the biggest mechanism, we're gonna miss a lot of people. So maybe you can put canvassers on your list.
That's a good idea. Absolutely. Olitha, Senator?
When we are doing the testing, like what we're doing at Health Corps, Grace Med, the drive-throughs, could you not allow them to pass out masks and thermometers so that individuals can have those with them at home? when you talk about canvassers seeing what the need is, couldn't you give those handouts at that time?
Certainly. Yeah, that's a great idea.
What do you think, Commissioner Howell?
Actually, I'm still thinking about what LaWanda said on canvassers. I'd like her to be more specific. I understand the lack of internet, and it's absolutely a truth. I'm not going to question that. That's for sure. But what would canvassers be doing primarily? Is it about communication? Is that what we're trying to do? Is make sure they have the information, and by talking to them at their door? Is that what we're trying to do with the canvassers? What's the intent there exactly?
I don't know if... LaWanda, are you there? Can
She stepped away from the microphone, it
someone
looks
mute
like. So
themselves?
Well, doesn't she mean that we want to find out who does not have access to internet?
Yeah, I think we just have to do, we have to, community organizations, looking through the churches, any type of way that we can, a mail campaign, cable TV, those people who don't have, I mean, people who are, there's LaWanda, I mean, I think that we're just trying to communicate with anybody and everybody, and how do we hit all those pockets of people who don't have internet, who don't have cable TV, who don't have those, who don't attend church. Those are the things. I think that's what she's talking about. LaWanda, did you want to?
Yeah, that's exactly what I'm talking about. The people that won't be looking at the internet, they won't be on the county's website. How do we make sure that they are getting the information that they need? And so that's what I was suggesting, canvassers, organizations, the ministerial league, handing out flyers to their members, things like that.
I would just say canvassers is probably the most difficult part of this. If we can do flyers through any organization you can think of, I'm even talking about potentially billboards, which people drive by. Billboards is a way to communicate. So if we can communicate in any way you can think of, but canvassers, when we're talking about a community virus, I have some concerns about that.
Yeah. But there are people that are, I volunteer on Fridays. We take meals to 750 homes. So I'm concerned too, everybody can't do that. Absolutely. We know we can't, but we just need to find a way to reach people, whatever that looks like. Whatever that looks like. Billboards, I haven't seen very many billboards like on 8th and Ohio. So we just have to make sure that we find a way to reach everybody or as many people as possible.
So we do have a couple of questions. Says, how will they regulate the businesses concerning the use of PPE? There are some fast food places not using masks or gloves. That's an enforcement question. I think that's very relevant. If you don't have any way to enforce things, Commissioner Howell?
Well, I don't know. I'm not sure what enforcement you have in mind. If we're expecting to have someone from the government go in and try to catch the people, violating these practices, I don't know how well that's going to work. But
well, additionally, so I think that's something that we need to work out. Another question, Senator Isiah, just to how would or would any monies be set aside for children and adults dealing with trauma because of the virus? We absolutely, that is something that is high on my radar. We have so many financial concerns. We have domestic violence happening. We have children at home who are out of routines. We have so much to consider, and we have to absolutely understand that the virus, there's more than just the virus that's going on right now. What that exactly looks like, we really have to pay attention day to day. I said earlier that I spoke to Joan Tamity and of our ComCare, she is the director of that, and she said that our calls are actually down. And what does that mean? You know, are we going to see a spike in suicides later because of financial concerns? I mean, there's just so many after effects. So I appreciate the question, and I think this is an ongoing conversation that I would love to have with you all. I mean, who else wants to chat about that?
Commissioner, real quick, I just want to highlight, we have 13 minutes left, and there are two bigger items that we hadn't got to yet. So the business interruption grants, specifically for our Black-owned businesses that were suffering prior to the pandemic, are suffering even more now, and will probably continue to suffer. Part of the PPE conversation was about our barbershops, beauticians. They cannot work without being in close contact with people. And so they are even looking at people not coming back for those services at the level that they were before. So if there is an opportunity to, where is that echo coming?
I think it's.
If there's an opportunity to get those business interruption grants out, and the number that we proposed, although it's big, is something that our businesses need, and making sure that anyone who would apply for that was not able to receive PPP or higher funding before. Again, making sure we hit the folks who were left out. And specifically, when we look at minority-owned businesses, the number that we had highlighted was $5 million, which is a quarter of what was proposed. So it's not the whole amount, but making sure that minority businesses who tend to not have access to financial opportunities have access to this funding so that they won't close their doors permanently. And then the other item of childcare, because there are parents who will be going back to work who don't have now school for their kids, they may need assistance for childcare. So we wanted to highlight those deals. I know we've got 12 minutes left, but make sure we get that out there and see if that was a possibility for the county commission to consider grouping that $20 million together and doing that going forward.
I think that's absolutely something that we have to consider. And with the Witt O'Brien folks understanding how to spend the money appropriately, the one thing that makes my heart burn with business interruption grants is we have a ton of businesses. And so how do you regulate one pot of money for one group and one pot for the other group? And is it picking winners and losers after that? This is where my mind is going. So yeah. I think, utilizing the conversation we're having here, subsequent conversations that we have, that's something definitely we need to have further conversation on. And it's important. Well, it's absolutely important that we understand the need of the community and making sure we help those. I don't want to see anybody shut their doors.
Well, just let me know. I'm happy to join. I know the Alliance is as well. Whenever that discussion happens, just to highlight the fact that minority businesses tend to get picked to lose anyway. So this is an opportunity to make sure that doesn't happen. So having to set aside for anyone who might oppose something like that is not a bad thing. It makes sure that everybody actually receives it. Because as we've seen with these PPP funds, I think in Wichita, only one Black-owned business received that. Well, again, we're the ones that continue to suffer. So happy to join in on that discussion whenever that happens as well. I'm sure the Alliance would as too.
Sure. Senator?
And Lacey,
yeah.
Just real quick, I think that it's imperative that the commissioners and the Oversight Committee work to provide as much resources as possible into this business interruption grant possibility. I think that if the commissioners are serious about re-empowering these minority businesses, that they should invest in the stability of those businesses so that they do not go under. Many of the small businesses without this assistance, they will not be able to reopen their doors. And I believe the last statistic stated that 96% of minority businesses did not receive PPP. And I think that's just a travesty in and of itself, that you could have millionaires and billionaires that received a lion's share of these resources federally. I hope that the county commissioners would see that this is a need for our community to make sure that we get access to some type of significant resources to prop those businesses back up.
I hear you, and I'm right there with you. I hope that we,
And
Levanta?
yes, along those same lines, I don't know when you will start disbursement after you have this small committee or a smaller group of people that are looking at this, but a lot of our businesses would really like to have PPE, plexiglass, something that makes sure that they are not harming their clients. That their safety of the clients is very important. So incorporating the plexiglass, the mask, so that again is where we're looking at PPE, and I think that's very, very important for our small businesses as well, because there are many people that might not visit some of our businesses because of the lack of safety equipment.
Sure, and I think that's when we get the, what are we calling it? We're sending out a notice of funding opportunities, that solicitation that I was talking about earlier, for people who need that kind of assistance. So sending it to you, helping disseminate it, making sure that we get everybody that information as to how to request that kind of stuff.
And I'm glad we came back to the point because your minutes are winding down, but we're also looking at mental health and aftercare for those who are suffering from the virus and may not have the insurance that helps them with the aftercare. And then looking at the mental health aspect of where we are and what's going on. Possible depression for those who lost jobs or for those that are out of work. And again, looking at that child care for those parents who have to go to work because they are still on the front line or have lost their jobs and need to get back out there and find jobs. So assistance with people along that line as well.
I agree. I think it's so important for us to take care of not only our physical health during this time. So I hear you. It's well on my radar. We are kind of winding down. We have about 7 minutes. I think Joseph says to everybody how, somebody else just said something. How are there individuals dedicated to helping our small minority-owned businesses apply? Paperwork is absolutely intimidating. I think that we should really consider all of the paperwork that's involved in making sure we send. I know that the Small Business Administration is very, very helpful, and maybe it's just hooking people up with the right help in the community. Going back to communication, helping people understand where to get those resources.
Hey, I wanted to go back to, I know we talked about PPE and going back to what Kevin was trying to say, and ensuring that we are really clear about the numbers and how the Black community is being disproportionately hit. Now we're looking at a second, third, fourth wave, whatever that's going to look like. So we know that those numbers are going to double and triple down on people of color. And so making sure that when that money is spent, that it's stretched to ensure that we have supplies that last past the money itself, and that those supplies are still here for the fall and the spring, because we're still operating in a space where there is no vaccine and those types of things. So our businesses, which are struggling, to Brandon's point prior to this, definitely need to be a part of those groups that get these monies quickly, and that they get this PPE quickly, so that when it does come time to open, that they can recoup, because they're already losing thousands of dollars. They were already not getting those loans out the gate for a number of reasons. So I just want to ensure that we're not being too frugal with the 99 million, and that we're backlogging some of this stuff for our businesses to have well into fall and spring when we actually go back into cold and flu season. And that these tangibles have dates with the end of them. And then we do have 3 names that we would like to propose to serve on this group and the oversight, because while I believe there is one person of color, I don't want to overspeak, you might have some other representation there. We do need to ensure that those voices are heard and that they're bringing those experiences. Because if we're not in this space, unfortunately, those monies will not get directed. And we want to ensure that someone is speaking from that vantage point and from that experience background of educating, ensuring that our communities are in fact moving forward with the PPE, the monies that they need, the loans, whatever that is. And I think 3 of the names, Brandon, if you want to go with some of the names that were proposed, so we can have some tangibles out here.
Yeah, so we have Michelle Van, Bryce Graham, and LaWanda DeShazer.
Yeah, that's absolutely something we will talk about. I really want for you guys to know that the transparency behind all of this money being spent is going to be out in the public. These conversations are going to be out in the public. This is something that you guys and every person is going to have an opportunity to have their voice heard, for sure. That is a guarantee I will make for you, to you all. I have Aaron, did you get that? Well, this right here. So we have a spreadsheet that was sent to us about how we're going to disseminate some information. Are you showing it? There's no information on here right now, but the money that we talked about that was proposed to be spent, where is it? I have like 15 documents up here. Okay, so, the $1.8 million for personnel, there was some total requested budget authority. Some of it we've already spent on PPE. And so a breakdown of how this is going to be spent is going to be absolutely available for you to look at, and the discussion prior to, certainly. I hear you. Okay, everyone, we have 3 minutes. Is there anyone else that I missed?
Commissioner Cruz.
Sure.
I just want to just go back to the testing again, and I know you guys have a van at ComCare, and you're looking at buying another van. I think that we really would like to see mobile units going from different areas. A van cannot handle all the citizens in South City and North Wichita and Northeast Wichita. Once the communication goes out, the numbers are probably going to go up, and it's still if you have a center out on West Central, you're still not really capturing everybody. You're still asking people that may be sick to ride a bus to go get a test. That doesn't sound right. It's an option, but we're still hoping that mobile units are dispersed throughout the city. And Health Corps said that they can do more work, and they have not received funding from the county to date. And since you said you have capacity, maybe that capacity could be given to the Health Corps. And since they're already in different areas and Grace Med, they can offer more services, because right now they have not received any support financially from the county or the test kits. So maybe you can shift some of that resources to those entities that are doing those things to help the health department.
Yeah, we talked about that just before I came to this meeting, actually. So, yeah, I mean, if we're sitting on 9,000 test kits and Health Corps runs out, certainly. I mean, that's exactly what being a good partner is. And I lost my train of thought, actually. Oh, the mobile. Yeah, we were talking about mobile testing as well. I had somebody call me and they wanted to test to their house. Well, understanding the people that are administering the tests are up in full PPE, and then do we just suit somebody up? So absolutely, we've been talking about making sure that we can meet people where they're at, and the most efficient way possible, the safest way possible. It's a great idea, and one that we have been talking about.
Hey, Case, Commissioner Cruz.
Sure. Yeah.
Commissioner Cruz.
Representative Finney. Yes.
Yes. I was wondering, had the county considered hiring a minority public relations firm to do the communications to the community, and to also to get a massive public service announcement campaign going?
That's a good idea. Yes. We have not considered that. Not that I'm aware of, but it's one to absolutely consider. Yes.
I think they would be really effective at reaching this community. And like I said, that's one thing that we haven't talked about is an issue of this sort. You should be able to get massive PSAs from the TV, the radio, and even the newspaper. It's just something to look into. And then, it would just really crown the effect if you had a minority firm that could reach out particularly to the African American community.
That's a great idea.
So please consider it anyway.
Sure. Yeah, absolutely. Senator Faustido, you are muted. Unmute so we can hear your beautiful voice. There you go.
Okay, is it possible that Aaron send out some of the notes that were, some of the information that was discussed today? Mm-hmm. Is that possible? And then I just wanted to say thank you to both of you commissioners for taking the time to hear our concerns, and I hope you will put it on your agenda and to put action with it.
Certainly, I think there's 2 people taking notes in the room today, so we'll send out a follow-up to make sure that everybody kind of gets that information. I'm putting my email in the chat right here real fast, so if you guys have any other questions or concerns, you can email me directly.
Hey, really quick, Commissioner, could I highlight one thing that the young man, Joseph Shepard, said? And Joseph brought up access, but is there an opportunity for this funding to be used to work with maybe AT&T or T-Mobile for hotspots? The city of Wichita does that on a small basis. We're trying to expand that right now during the pandemic, but maybe some of those funds could be used for that, and that could be something that folks check out. I'm sure I can get our CSRs to work with you all, but we have a checkout basis where you come to our resource center, you check out a hotspot, you get to keep it for 2 weeks. The signal's actually strong enough so it actually works for your house and your neighbors on each side. But something like that, or maybe some other equipment that could be installed in the community to help with Wi-Fi access in these lower income neighborhoods. And I don't know if that's covered under the funding, but maybe an idea.
And Commissioner Cruz, that was one of the things that we are looking at, even as far as our youth losing part of their education during time and during the summer. They're out of school almost five months. And so to be able to have hotspots in the community so that our kids don't lose out completely would be very, very important. And I would also like to say thank you, Commissioner Howell and Commissioner Cruz, for taking the time today to be with us.
Commissioner Howell, do you have anything to add before we close?
I would just wanted to say I appreciate the great discussion today. I think we have come up with some really good ideas. I would say with regards to the $99.6 million, I don't think we're trying to be stingy or people use the word frugal. I don't think that's really the right word either. We want to be careful, and that's the word I'd like to use, because if we misuse that money in some way, we've got to pay it back. And so anything that qualifies under the program that is eligible, that goes through this committee, that sounds like it would be helpful to combat COVID-19 in our community, I think you'll have support of 5 commissioners. I really believe that we all support using that money any way we possibly can. That's the legal way to use it. If you just peanut butter this out, it's about $14 million a month. And so far we spent about $3 or $4 million has been earmarked thus far. And that's a huge amount of money. So we have ample funds. If we can find ways to legally use it, I think you'll find support.
Well, thank you all so much for joining the call today. I just want to remind you that this will be back up on YouTube and Facebook. So if you want to share it, the communication will be there for you to rewatch later. And so please let me know if you have any questions or concerns. My email is in the comments. Are we good to go? Thank you so much, you guys. Have a good one. Bye-bye.
Thank you.
Thanks all.